we present here a method for quantitative analysis of tumor collagen in bright field histology images. And for quite some time, we know that collagen is an important part of tumor tissue, and that aligned collagen and specifically organized collagen is an important predictor of patient survival. So, but to achieve this, one usually needs to use some specialized imaging technique. So naturally, a question arises that, is this possible from bright field images, and preferably in an automated way? So indeed, we show that a neural network trained on a small set of manually annotated image patches can then detect and extract the collagen framework from routine pathology images. So we applied our model to hormone receptor positive breast cancer patient cohort. We used a single TMA core per patient. We had 93 patients in our cohort, and we were able to produce these collagen framework segmentation maps. And for these maps, we were able to extract features at the different levels, say morphometry, orientation, and texture. And we also show that in principal component analysis, these extracted features, they fall into independent factors that reflect different aspects of tumor collagen organization. Further, we were able to use these features to stratify patients into prognostic groups and say, regarding fiber morphometry, we saw that the longer, wider, and more curvy fibers extracted by a network all result in the worst survival of patients. And in multivariate analysis, we see that fiber morphometry outperforms, is an independent, of course, predictor, and it outperforms some well-known classical pathology indicators such as tumor grade, size, and lymph node status. Thank you.
Thank you very much. Any questions?
So first of all, let me congratulate you. This really nice piece of work.
Thank you.
I hope that you can take it further and you know, publish it in a decent place. I just want to clarify something. Is it hematoxylin eosin that you're working on?
No, we trained the model on, so initially we had slides stained with Ki-67. We uncovered the slides and stained it with Sirius red, so to have the brighter collagen, and trained model on these images. But then we applied the model without any retraining on hematoxylin. It performs similarly. It also works on pus-stained images, and we tried some even exotic stainings. And it is not specific to single tissue type. It's robust method.
Thank you.
Yeah, no, very interesting work. I see a lot of applications for this. Did you do the how did you get the training data and then apply it to the other staining types?
So without any retraining, we could apply to pus, for example, and hematoxylin, the same model. Yeah.
It's very interesting, and I've seen your poster already. One question, you show the survival curves. Mm-hmm. How did you choose to cut off between, let's say, the high and the low one? Because I noticed the ones doing well, the patients doing well, was a very large group, and actually you only found like 10% that is doing poorly in prognosis. So how did you define which ones are the high and the low group?
So we just used the R-based package cutoff finder, the published method to find the cutoff.
That's not a good answer, I think.
Well,
the cutoff finder, but do you know how the cutoff finder finds a cutoff?
Yeah.
Do you know what it's based on?
Log rank.